Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sharrie Harlin, program host for Let's Talk Together. And today we are joined by our two guests are from the newest department at Reid Health, and it's called Community Health. And we are joined today by Andrew Hoover and Ashley Shepard. Welcome.
Hi.
And before we get started, both of you tell us a little about how you came to Reid.
I can start. So I came to Reid about 4 years ago. Always worked in the community, but needed a little bit of a change. And the middle of a global pandemic seemed like the perfect time to come into healthcare. Originally started in our emergency department, working in registration. Then quickly went into work in our marketing department the last few years, and then just recently transitioned to our community health team. I'm super excited.
And Ashley?
I came to Reid about 3 months ago. Our director was my old boss at an old job, and she reached out to me and said that this position would be good for me, given my history working with mental health and just in healthcare in general. So,
Well, welcome both of you to Reid, and also let you know that actually that's part of one of the departments we work very closely together. So, this is exciting for me. Tell us about a little bit. Both of you had such different backgrounds, and it shows the wide range we have in health and engagement so that you bring to the table. So tell us about how this department got started.
Yeah, so I would like to say too, our director, Jess Shebish, is not here with us today, but she has a long background in social work and building community health programs in the community, many of which that are very successful programs in the community today. So a little shout to her, because I don't think our department would be what it is without her. So, so the community health department was formed through Health First Indiana, which is a public health initiative throughout the state of Indiana. And the goal of Health First Indiana is to create public health infrastructure in communities. Nearly $75 million was available to all 92 counties in Indiana in 2024, and in 2025, there'll be nearly $150 million distributed. So all 92 counties in Indiana are receiving funding, and Wayne County Health Department received just about $803,000, and through that, they gave out grants to local partners. There's a few different local partners in our area, and Reid was fortunate enough to be one of those grant funders, and that's how Ashley and I got jobs and how our department is funded at this time.
Okay, and do you partner with other agencies? It's just internal Reid, or how does that work?
So I would say that collaboration is 100% key to what we're doing.
Right.
So a lot of our main focuses for our department were established by Health First Indiana, the Wayne County Health Department, and then Reid's very own Community Health Needs Assessment. So our three main areas are tobacco and vaping prevention and cessation, chronic disease prevention, and trauma and injury prevention, which we'll kind of dive more into these areas here soon of what we're offering. But I think collaboration is key because we have people in the area and the community that are already working on these topics. And our job isn't to replace what they're doing, but how can we enhance it and reach even more people in our community so that everybody has access to healthcare.
And you named those three areas. Could you go into it a little more on, for instance, for the tobacco and vaping?
Yeah.
So for the tobacco, smoking and secondhand smoke causes over 480,000 deaths per year. Smoking harms every organ in your body. So we will be utilizing the American Lung Association's Freedom from Smoking Cessation course. It's an 8-week course. It'll be free to everybody. We hope to have that up and running probably beginning of February. and we will do that through referrals from doctors, people in the community that want it, or we will be working with businesses for their employees who would want to participate in that program.
And once again, this is Wayne County.
Wayne County.
Okay.
And then additionally with the vaping and smoking prevention, of course, is vaping. And we're working with Catch. Catch is a nationwide evidence-based program that creates health initiatives for children. So they work on tons of different areas across the health spectrum. But primarily we're going to be working with their Catch My Breath program. And the Catch My Breath program works to reduce and prevent children from vaping. So it's for grades 5 through 12. And we are trained in that, so eventually we'll be able to either teach this in our schools, our local schools, but also we can educate our educators to teach this program without us, which is something we're excited about. And we think that's a huge topic. Children as young as 4th and 5th grade are vaping in our schools, unfortunately. And while sometimes I think we see vaping as that little bit healthier option, it's not at all. Vaping can still cause multiple diseases. It damages brain development, especially in our young children that are doing vaping. And it can affect pregnant women and their fetuses. Vaping is, in my opinion, and I think fact-based, just as nasty as tobacco. It's just a different flavor.
So if I'm an educator and I wanted to reach out to both of you, what would I do?
Exactly. Would you like to take it?
An educator. You could email us at the Community Health web or email, or call us, or we have our business cards. Reach out to us that way.
And you will go to them?
Yep.
Yep.
We are, the cool part about our department is we are completely mobile. We have desks, but we're not at our desks very often. Our job is to be out in the community and educating people on the issues at hand. And we realize that not everybody has transportation to get to where we're going. So that's where our job is to drive to them, meet them, and make sure that we're holding our workshops in places where people are and where people gather.
And on the trauma and injury prevention, can you share about that?
So we will focus on fall prevention. 14 million, or 1 in 4 adults over the age of 65 report falling each year. 37% of those require medical treatment. And that creates over 9 million fall injuries a year. Falling is actually the leading cause of deaths in ages 65 and over. So our fall prevention courses, we will be going to nursing homes, patients' home, community events to offer fall prevention training and education.
Well, another example I just thought about, for instance, if I'm a senior center in Hagerstown, would you come and give a talk, or what would you do?
Yes, as long as it's Wayne County, we can go to residents and local places in Wayne County.
Okay.
And people outside of the county can come to us. We just can't go outside of Wayne County.
Okay.
And some other big areas in our trauma and injury prevention, distracted driving in adults and teenagers is a very big issue. Over 3,000 people die each year in car crashes due to distracted driving. So we're working with a program called Impact Teen Drivers, which is a nationwide program to teach distracted driving to teenagers. But also, I think two of our big areas also is safe sleep for infants. So sudden unexpected infant death, or commonly referred to as SUIDs, are the #1 cause of death in babies under the age of 1. And nearly 3,400 babies a year, unfortunately, die due to an SUID and unsafe sleep conditions. So we're going to be teaching safe sleep to expected parents, caregivers, and just the general public. Because the more people that know about safe sleep, the safer our community will be.
One of the examples that I've understood through safe sleep, often people think it's fine to have their baby in the bed with them.
Absolutely not. We're both getting a little like, so practicing safe sleep, basically, to put it simple, a baby, you should practice the ABCs of safe sleep, which is alone, on their back, in an empty crib, on a firm, safe surface. So one of those things can be obviously using a crib or a pack and play. And that's one thing that we'll be working with, is to make sure that parents have pack and plays. Because not everybody can afford a place for their child to sleep safely, and that's where we can obviously help with that area. Another important area is transporting your child. child passenger safety is a big issue in our community and throughout the country. So we are working with other community partners. We have multiple area groups that we're working with for child passenger safety. Late last year, we got trained. Cut that, because we're saying this is 2025. So not too long ago, I got certified as a certified child passenger safety technician, basically a car seat tech. Ashley will be getting that training here soon, and the goal is that we're able to educate parents on safe restraints for car seats, to know what car seat is the right for that child, and to make sure that parents have ease of mind when traveling with their children, to make sure that they're safe. And part of that includes providing new car seats, because not every car seat on the road is safe.
And part of your training, and I understand that that's a big thing, that often people don't put in their car seats properly, and they're not aware how to put it properly. So it's part of your training, which I understand is like a week-long training.
It was about a week-long training that I went away for. I had never put in a car seat before the training, but I have put in plenty of car seats now. But the training is really cool, because it shows there's different kinds of vehicles. Everybody has different kinds of vehicles. Every car seat's made differently. So understanding which car seat is right for you. A lot of people want to know, what's the safest car seat? The safest car seat is the car seat that you can put in every single time correctly, the car seat that works for your vehicle, and the car seat that works for your child. And that's one thing that we can help identify and make sure that you're comfortable with the car seat. And some common things that people don't always realize is it's not ideal to buy secondhand car seats. You don't always know the history of that car seat. So if it's been in a car accident, if a car seat's been in an accident, you need a new car seat. If a car seat is expired, car seats expire. There's expiration dates on the back. If things are damaged on the car seat, that's things that we will look for so that we can help people. And if there is a need, we can supply car seats to people in need as well.
So I'm sure people get in often and wonder, because sometimes the difficulty of the car seat, there's probably instances where people have damaged the car seat themselves trying to get it in and out.
Yeah.
So
Exactly.
so that both of you are here to educate our community about what they should do. Another thing is chronic disease prevention. Can you expound upon that?
Right. So with chronic disease prevention, we will be providing resources and education for people in the community. We go to community events. We go to doctors' offices, just different places, provide that education on topics such as diabetes, heart disease, high blood pressure. We will be offering here soon free blood pressure checks and glucose checks at community events. And that way we'll be able to refer people. If they don't have a family doctor, we give them the referral card and help them get a family doctor. Or if they do have a family doctor, just let them know hey, call your family doctor, let them know that your blood pressure was high or your glucose was high, and just have that checked out by them.
So actually, you are like you're the frontline people. Often you can also refer and show people how they can get a primary care doctor as well.
Exactly. And another part of the chronic disease prevention is teaching healthy eating. And healthy eating can look like easy meal prep, and also just connecting people to local food pantries, local resources, and how to use the food that they're getting, such as the benefits of our Richmond Farmers Market, our local food pantries and food banks, so that we're educating people. And the cool part about our department is while we may not be dietitians, our department's about that collaboration we mentioned earlier. So we can bring in some of the dietitians that Reid has, and maybe some local chefs and things like that, to collaborate to teach people healthy eating. And right along with healthy eating is physical activity. So we're fortunate at Reid to have a great fitness team, which I know has been on your show before. And that is something we're working to collaborate with as well, so that we can incorporate fitness to keep people healthy as well. And that doesn't exactly have to look like going to the gym. Our goal is to work on some home easy exercises that someone can do anywhere they are, to just kind of incorporate healthy living and healthy eating to reduce that risk of chronic disease.
Just to continually to educate our community. Your theme is your connect, educate, and support. Describe how your mobile, we talked about your mobile in the community. So can we expand upon that?
So for Connect, Educate, Support, Connect is just us connecting with as many people in Richmond as we can, educating them on all of these issues, giving them resources so that they can make the best decisions to make themselves and Wayne County healthy, period. And then for support, we don't always have all the answers. So for us, it's we're going to refer you to this place or have these people reach out to you. So yeah, it's just a roundabout circle for us.
And I can't express it enough that everything you offer is free.
Everything's free.
Absolutely.
No questions asked.
I do like to throw in the sideline that there are times we might refer you to another department or something where a cost might incur.
Right.
But the cool thing about our initial services, we don't necessarily care if you are a Reid patient currently. We don't care if you don't have insurance. That's something we can obviously help you with, but at the end of the day, we're not asking those questions. And I think that's really cool. And while we do say Wayne County only, our services just have to be in Wayne County. So if somebody is watching outside of Wayne County, you're more than welcome to come to some of these classes and things in Wayne County if you have the ability to get here. So.
And I want to express that one of our community education programs that I'm involved with, our Medical Monday, that you are now one of our community partners, and you are there monthly. And share about what you do at Medical Monday.
So I think that one of the cool parts about Medical Monday is it's reaching people in a place. You guys are already teaching them amazing skills every month, but we're able to bring in another topic or even bring in more resources on the topic that you're speaking about. We also bring gifts. One of the things
That's always a bonus.
It is a bonus, and that is one thing that I'm very fortunate that we have is we have a hefty pot of our funding is for incentives. I will give huge props to our director, Jess. She's worked in multiple community health roles in building programs like this across our area, and she knows that incentive-based things work. So when we are going to things like Medical Monday or we're going to hold these classes and things, we know that sometimes we have to give people a reason to come, and sometimes health education's not the only thing they want. So we're able to give away crock pots and electric skillets, air fryers, gift cards to get food, bicycle helmets, maybe bicycles, car seats, pack and plays, things like that that can draw people in. I think that's one of the really cool things that kind of sets us apart from some of the people that we're able to collaborate with, where we can collaborate with them, but we can say, hey, we can help with the education, but we can also bring prizes because prizes bring people in. And sometimes that's what's needed to get people in.
Well, that's one of the best referrals you can get.
Exactly.
Look at the prize I won, and I worked with Reid Community Health. So people are more, so how do I do that? And then people can share your information and get more people educated.
Exactly.
So that's always great. Show us, one of the big things in health in the healthcare world are social determinants of health. And those are the non-medical factors. Can you expound upon that?
Absolutely. So social determinants of health are the things that we don't always think about when we think about our access to health. And they're barriers that people have. That could look like transportation. It could look like housing, access to food. One of the new things that people don't always think about is access to technology. These are all barriers that people have to their access to healthcare. And kind of you can make a checklist for people, unfortunately, at times where you basically say, oh, they don't have this, this, and this, and this, and it increases their risk of chronic health issues, or it also decreases their chances of maybe getting to the doctor and having access to care. And that is one thing that I know your department obviously works on in community engagement, but also our team is helping to work on to where we can eliminate some of those determinants of health so that more people have access to health. And I think one of the really cool parts about this is when it comes to our social determinants of health, how can we work with some of our own employees inside of Reid to educate them? So maybe it's working with members of our emergency department or our admin team or our food nutrition team and educating our own staff members on what some of these social determinants of health look like so that we're all on the same page, and some of our community partners as well that may not be aware of what some of these issues are, so that everybody's on the same page to have equitable access to health.
And one of the challenges we have in our area, when you were saying about technology, there are some, and we're working on it, but there are some areas, it's not a matter of the person couldn't afford an internet connection. It's just not available in those areas. So as we try to work on that in that area, so that's something that we also have to think about, because often, I know we learned that during the pandemic when people were they couldn't log on at home because it's not available. Certain internet services just weren't available.
Exactly, and I think that's one of the parts I'm most excited about with our program. I know, obviously, I know you very well. I'm lucky to know you, but you and I discussed before this department was even public that this program is great for Reid and our community because it puts more people out on the streets to hear things and see things, so that hopefully we can bring about change in our community. So it's noticing that technology. It's no secret, transportation is sometimes an issue in our community. So more people to be on the streets and hear from our patients and hear from the community so that we can take that back to the Wayne County Health Department, to our city government, to our state officials, to our Reid Hospital administrators, and everybody at the table to create more health access. I think that's the overall goal of our department, is to make sure that everybody has access to health care.
And I will say with transportation, one of the reasons that we focus so hard on being mobile and getting to people is so that we can provide, they don't have to worry about getting to the hospital, getting to our building to do these classes and get this information. We will go to them.
And that is huge
Yes.
for our area. I'm on some other committees I'm on, that's probably one of the biggest things that when people say, an example even with schools, if mom and dad, they missed the bus, they missed the school bus, their car's broken down, what happens next? They missed a day of
A
school.
lot of times they're dismissed from school.
Sometimes it's like a slippery slope.
Yeah.
So by offering these other avenues to do that is great. What's another thing is with you expressed the different workshops, and so far, what's been your favorite workshop?
I would probably say the Learn Together, we did a Learn Together at Circle U. They have weekly meals there, so we just went, sat at a table and offered, I think we gave away strainers to everybody, and then we offered education on diabetes and healthy eating. So yeah, it went really well. That was good.
And it's always interesting when you go to locations like that.
Yes.
And then especially once you start to offer like blood pressure screenings, there's times when you're out in the community, it's like, whoa, we need to get you more help
Yes.
immediately.
Yeah.
And so that's a really great asset that your team is going to bring to our community. The other thing is, when you express the incentives, what would be the one thing that, and I'm getting on both of you, that you would like people to know about your department?
I think for me it is, well, like I said, us being mobile and meeting people where they are at. People can't help their circumstances. Not everybody has the same circumstances, and I think that is something that is our responsibility to be aware of. So just getting out there, meeting people where they're at, providing these resources, and making sure everybody has the same fair access to health care in general.
And then, Andrew?
So I don't want to copy her answer directly, but I think the one thing that you'll learn about our whole team is we all really do care. Our heart is here. It's where we want to be. But I think the thing I would want people to know is no judgment in our department. And like I said earlier, it doesn't matter if you have insurance or not, if you're an established patient with us or not. You could make $1 million a year or not have any income. And our goal is to help you get access to healthcare, because unfortunately, the healthcare system can be very, very, very complicating. It doesn't matter if you work in healthcare or not, it can be very, very complicating. And our goal is to kind of guide people through that. Sometimes it could just be giving our department a call and just saying, hey, I have a question about this. Absolutely, let us get you to the right person. So I think mine would be no judgment. Like there's that old saying, there's no dumb question. There's no dumb question for our department. Let us help you and make sure that you have access to healthcare.
And a lot of times I think people don't realize what resources are available to them. Like I had no idea about the farmers market double dollars or double WIC dollars until somebody told us. So I think just, again, getting that information out into the community is beneficial for them.
And I will say too, with that, I mean, if we have community partners watching right now that have things going on that we need to know about, reach out to us. I know some of our information's been popping up on the screen, where you can visit our website and fill out a form. You just kind of scan that QR code and go, and you can fill out the form and get more information from us, but also our email on there. Because there is a lot happening in our community that I don't think people are always aware of. I always say that if you don't think there's anything happening in Richmond or Wayne County, you're just not watching or listening, because there's always something happening, and there's tons of things happening that we probably don't know about. And we need people to tell us some of the things. We're out trying to figure it out, but if you're working on something that you think our team could help with or assist you with, please let us know. We're all about collaboration.
Well, we want to thank both Andrew and Ashley for joining us today, and we showed how people can get in touch with you. And once again, thank you for joining us on Let's Talk Together.
Let's shine by seeing the best in all of us and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.